Thanks everyone for joining us for our quarterly DHS OCI Healthcare Coverage Partnership Forum. We did postpone this one a couple of weeks so we could get into the start of the open enrollment period, and we'll spend a lot of time today talking about what we are all doing with our partners and with our agencies on spreading the word about the open enrollment period. So we'll get to the agenda. So we will start with that focus, the open enrollment period, from the marketing and promotions work group. So those folks will share some of the work that they've been doing on materials and messaging for open enrollment. Then we will go through our work group reports, our usual report outs from what's been going on in the various groups, and have an opportunity for agency updates from OCI and from DHS. And DHS will speak to some unwinding updates at that time as well. And then we will take questions and have some general opportunities for feedback at the end. So appreciate all of you joining us and hope that you chime in with any of those questions or input so we can hear your voice on these issues. So we'll get into the open enrollment update, and I believe I'm handing it to Stephanie to talk about what the marketing and promotions work group has been doing.
Okay, thank you, Sarah. So to get started talking about the upcoming open enrollment, we just wanted to do a quick recap of how successful our enrollment was last year. So we had over 220,000 people sign up in our state on healthcare.gov. That it was the highest enrollment since 2018. It was close to 9,000 more than the year before. As you can see, the graph is my favorite because it really just shows after the federal government stopped investing dollars in marketing for healthcare.gov, how enrollments really did plummet. But then once this group started, they really started to go back up. I can't say that it's only this group and our efforts who have led to that increase, but we like to take a little bit of credit. Okay, so let's start off with just a couple updates about the WISC covered site, which is the platform where all of our statewide promotional dollars are predominantly directing people. There is one other site in Milwaukee to be a little bit more specific to that region. So it has 2 calls to action now when people go on, since we are in the middle of both open enrollment and the unwinding. So people kind of have an option of where to self-direct themselves, but if they don't know, they can scroll down and find other questions and answers and places to be directed. Since the press release that OCI put out on October 25th, the WISC covered site has had 1,928 website views, which we're pretty excited about because we're only a few days in to open enrollment. And those numbers were bolstered by a couple, yes, next slide, a couple of very successful press conferences in Madison and Milwaukee. The one in Milwaukee was organized by the Milwaukee Healthcare Partnership and had very good attendance with some local leaders there. And then the one in Madison, we found out last minute, we invited the governor and he showed up. So, and that one was organized by Covering Wisconsin and was very well attended and represented by OCI and DHS and was held at Senator Spano, very good partner in our enrollment efforts. And after those press events and the general announcement, we've had quite a bit of press coverage, which we're really happy about. And we hope that that will continue through open enrollment. Okay, and so I want to get to what has the marketing and promotions work group been up to. We wrote in the group, we wrote a script for the ads that are going to be streaming across the state. For most of the small towns and large metropolitan areas, throughout the state, we have streaming television. And then our more rural, very, much smaller towns, we're doing cable. So we're going to be in 56 networks, cable networks in 31 zones in the state. And this is an ad that it starts off with saying, do you need help paying for healthcare? And then jumps into some other pieces of the puzzle. In fact, do we have sound, Sarah?
Let's find out.
You need help paying for healthcare? I'm a health insurance navigator.
Is sound coming through?
Like me.
Yes.
Whether it's a plan from healthcare.gov or state coverage like Badger Care Plus. We help people find affordable or low-cost options so they can stay healthy. And the best part, our help is free. Go to wizcover.com to learn more or call the 211 helpline to find a navigator near you.
Okay. And as you can see in the branding afterward, we had some generous support from Anthem and ThedaCare and UW Health to help pay for these ads, which allows us to not just create ads, but extend our reach for longer and for a greater coverage area, which is really, really helpful. And that ad is also playing in Spanish as well. I don't think we need to play the Spanish, but the links are in the PowerPoint when it goes out later. Okay, there's also some Google campaign that's happening, leaning into that do you need help paying for message, but also taking it a step further and calling out some various different things that people might have that's more important for them, like a chronic condition, or maybe they want to gain access to mental health care. We have all of these. The Google Analytics are really nice because you can put about 15 ads out and it'll do A and B messages to see what's more effective in certain regions and with certain groups. And so we'll see how well these play. But there's a variety out. And so anyone who might be doing a search on their own, looking for anything related to healthcare, these would show up as a display ad. And those will run from November until January 15th. I believe we might do until February 16th since they extended open enrollment to the 16th. And these are also oftentimes sending people to Discovered, but sometimes they do send people to Covering Wisconsin, but predominantly it's to Discovered since you can locate a navigator through there. Okay. We have a lot of ads that are coming soon that will be on social media, including influencers speaking about their own experiences. They're not quite ready, but they will be very, very soon, and you'll start to see them. And as they're ready, I know both Healthy MKE and the Covering Wisconsin Toolkit will be posting those in their toolkit so that they'll be available for our various partners to grab and reuse. So I know Covering Wisconsin has a Barbie video that's coming that's pretty absurd and fun. And we also did a Halloween video recently. And from our partners at MCAN on the Healthy MKE site, there's some very nice, they're going to take some of these stills and create moving GIF type videos with them. Because one of the things we're really trying to promote is the human connection, that you can get help from real people in the state. Okay. These should be going live fairly shortly. These are a series of Milwaukee bus ads that will be driving around town in Milwaukee, and they feature local families who, or influencers who really wanted to be part of the campaign. And highlighting, it helps pay for family medical care. It might highlight access to mental health care, but really leaning into Milwaukee this year is leaning into the get it, use it, keep it message. And in Madison, there'll be a series of bus ads rolling around with the message, find free help with health insurance, really leaning into that connection with that there's free help available. Okay. Several of the agencies involved in the work group have toolkits, and this is a phenomenal way for us to just design some content. It doesn't cost a lot, but then our partners, like all of you, can help us spread the word and print and share on social media various campaign messages that we have available. So OCI has a wonderful toolkit this year. Some of the pieces that I like the most is that they took a lot of time working through some of the RENs in the more rural region to have a big rural voice. And I think that'll be really valuable for our partners in the rural regions. So within that toolkit, you can find social media posts, graphics, flyers, press release templates. And that's at wiscovered.com. You'll scroll down and you'll find a button there for the toolkit. The MCAN toolkit, as I mentioned before, there's the message this year is get it, use it, keep it, and using those real voices in Milwaukee. And then the other message you'll find in the toolkit is the real people, real help, highlighting that you can text message directly with a navigator via the WisCovered site, also the Healthy MKE site, and the Covering Wisconsin website as well. So those all link to a platform that navigators use to message directly with members in the state, or excuse me, consumers in the state. So in all the toolkits, you can put your own logo, which is really, really great. And there's a link here for the MCAN toolkit. And then the Covering Wisconsin toolkit has gifts, videos, outreach cards, and flyers. This year, we decided to also design an outreach card that's wallet sized, which is helpful if you're doing an event out in the community and people don't have anywhere to put a larger card. So that's something that would fit inside a wallet. We can help customize those and add contact information for you, and just reach out to Tina, and her email address is there, and then there's the link to the toolkit. We have a lot of content from years past. A lot of videos are available there, and in the next coming weeks we'll be uploading a lot more content. So okay, and then as when the slides come out, there are links here to each agency's toolkits, is in addition to their Facebook, X, or formerly known as Twitter sites. Some groups have an Instagram, and we really, really encourage you to like and follow so that we can spread the word more effectively across the state when various groups are putting out content about health insurance access.
Great. Thank you, Stephanie. All right. So now we are going to go into the work group reports. And our first work group will be the data work group. So I'm going to hand it to Kelsey Avery to talk a little bit about what they've been doing with data.
Thanks, Sarah. Hi, everyone. Just a couple items that I wanted to call your attention to today. First, if you've been attending this forum for a while, you might recall that DHS developed, with some stakeholder input, a data resource to support population level outreach and communications during the unwinding. This dashboard contains a variety of metrics that can be used by stakeholders who are engaging in outreach and communications efforts, and the resource can be used to help guide those efforts. The data in the dashboard is considered PHI, so access to that data is being managed by entities that have a data use agreement with the department. So if your organization could leverage data like this to support your own outreach and communications efforts during the unwinding, you have a couple options that you could pursue. First, if you're a member of a Wisconsin Trade Association, you might be able to work through them. Alternatively, you could also connect with a regional enrollment network or a REN, and a contact form is linked in the slides there. So if we go to the next slide, I've also described at some previous forums a forthcoming interactive dashboard that's going to be hosted on OCI's website. This dashboard will include data that's already publicly available, like census data, as well as some new data from OCI, but packaged into a more interactive and user-friendly format than you might find elsewhere. And this dashboard is in the final stages and should be ready to be circulated publicly quite soon. So stay tuned for that. And that's all from me. Thanks.
Great. Thanks, Kelsey. All right, so now we are going to go to the workforce capacity work group. I will be handing it to Bobby.
Hi, thank you, Stephanie and Sarah. The workforce capacity work group has been active since the very beginning. Lately, we've been focusing a lot more of our time on the IM partner work group, and that is a collaboration between partner agencies, IM agencies, and it's facilitated by DMS staff, Maciel and Alicia, and a couple of co-chairs from the IM agencies and myself. The purpose behind that group really is to do some troubleshooting, identification. We really wanted to be ahead of some of the issues as far as unwinding is concerned, to be able to discuss them, identify some of the issues that we're seeing in the community, hopefully resolve them. We've discussed issues from looking at some of the issues related to the unwinding issues related to administrative renewals, looking at issues related to presumptive disability process, looking at issues about emergency services for Medicaid and how it's applied sometimes to different populations, call wait times within the consortium, and just, hopefully towards an effort of better understanding, operating in an atmosphere of mutual respect, trying to understand these issues and then communicate them better to the IM agencies, the partner agencies, really working towards a better understanding of the role that everyone plays and how we can improve the overall process for many of the enrollees. And I think it's been very effective. One of the things that I'm very interested in doing post open enrollment beginning in 2024 is to think a little bit more intentionally about some of the opportunities to look at the workforce issues and think about some of the system and community knowledge barriers that we've identified and the related access to healthcare coverage issues that we see. This really translates into an opportunity to do more learning, community-oriented learning, working very closely with partners here in the partnership and across the state, particularly some of the internal partnerships we have, like working with Outreach and Education Committee, looking at some of the enrollment networks, because what a great vehicle to help provide some of the learning that needs to happen out there, just the basics, some of the basic understanding. We want to look at developing some recommendations that we worked on in 2021 that were really coming up to, really during COVID, we really had to pivot to more of the preparing for unwinding and those issues. But we really want to think about ways of developing learning strategies where not everyone has to have expert learning, but just from the mobilizer level to proficient, all the way to people that might need to get deeper into the weeds. We've got some structures. We want to put together some plans. Again, this is what I would like the workforce capacity work group to work on in 2024 after open enrollment. And I'm certainly interested in conversations with people that would like to join that effort. I think we have a lot of the pieces in place. Like I said, I think the RENs are a great opportunity for some learning. Annual enrollment conference obviously is a great opportunity for learning. IM partner work group, meetings of the navigators. These are all places for us to learn and try to understand the level of learning, the knowledge that we need, and how do these issues pass along from basic information to the more advanced, deeper in the weed stuff. I think it's an exciting opportunity. I think it's a chance to really channel some of the things that have been going on over the last several years and to develop a more cohesive, coordinated learning opportunity for people across the state. So it's planning, but you don't get anywhere without some planning. And so that would be my goal for the workforce capacity work group coming into 2024. Thank you.
Thanks, Bobby. Appreciate that update. So now we're going to go to the outreach and regional enrollment networks. So I will hand that to, oh, I can change the slide. There we go. To Carolyn.
Wonderful. Thanks, Sarah. And I will ask for forgiveness in advance for my congestion, but I'm here and I'm glad to be talking about our regional enrollment networks. So we have our now 10 enrollment networks across the state where we bring our partners together, including our enrollment assisters, our mobilizers, so the folks that get people to our enrollment assisters who are working directly with the community, and then our state partners like OCI, the Department of Health Services, the IM agencies, and really anyone who has an interest in making sure that our communities, our people, our Wisconsin residents have access to health coverage. And whether that's the state's Medicaid program, the health insurance marketplace, healthcare.gov, as well as other forms of coverage, and knowing how to navigate this big complex system. And this was a model that we had brought to the forefront during the Patient Protection and Affordable Care Act implementation back in 2013 and 2014, and have brought back about a year and a little over a year and a couple months over for the Medicaid unwinding period. And so the folks that you see on your screen are the various enrollment network leads across the state. 8 of our enrollment networks are regional, and then we have our 2 affinity groups, as I call them, which are the Latine Enrollment Network and our first ever, and it just started in September, Hmong Enrollment Network. Next slide, please. And just as a reminder, what enrollment networks do, or what they were originally founded to do, was to keep local partners informed about policy changes and enrollment trends. Also build enrollment assister support and capacity. So that's looking at a regional or community-based level of how many enrollment assisters do we have, how many more do we need, and what are ways that we can make sure that they are maintaining their certification, their licensing, and getting out into the community. One of the things that enrollment networks can do are host unique training specific to their members, or also promote trainings that are happening across the state. For example, the Wisconsin Enrollment Conference is a big event that all of our enrollment networks will promote. We also organize and streamline local outreach efforts. The outreach that's happening across the state is pretty phenomenal, where we're seeing different partners, whether they're doing enrollment work specifically, or they're just helping us get the word out. They're sharing these resources that we've been developing through OCI and the state and covering Wisconsin and Empower across the whole entire state. And what we're seeing, whether it's anecdotal or very preliminary, is we're seeing people act. We're seeing people react to the information that's available to them. And when we compare even the number of people who have renewed their Medicaid prior to the pandemic, so when we weren't doing all of this additional outreach, we're at higher levels today of people actually actively renewing their coverage. So even though we, strive to make sure everyone who is up for renewal does do so, we're seeing an increased impact of more people enrolling and renewing their coverage than we did prior to the pandemic, when this approach wasn't happening. And then, of course, as important as ever, providing messaging at that local level, but regionally and culturally. So thinking about how people in your community resonate with information. And then the best part is that this continues this partnership that we have both with the Office of the Commissioner of Insurance, the Department of Health Services, and many other partners, where we now have a venue to talk about local issues and bring it back to the state. And then the state also helps us troubleshoot kind of the trends that we're seeing in our community. Next slide, please. So where does that take us? Well, we know that we have the support and the funding to move this work through June of 2024. And so what we've decided to do was to reflect and see kind of where we've come over this first year of having our enrollment networks back in full function. And so we ended up sending out a survey to all of the enrollment networks, and we ended up getting about, and you'll see on a different slide that we got 37 responses. We're actually at 43 as of today. And I hope that we'll have many more after I talk with you all, or at least many more members of our enrollment networks. But we were able to share this survey and get feedback about what things are going well, what things we can continue to grow on, and then what are some ideas as we explore sustainability and making sure that these enrollment networks exist to help support coverage and access to coverage for even beyond unwinding. Next slide, please. So as I mentioned, I said 37, but we're at 43. And we have all of our 10 enrollment networks represented in the folks who have taken the survey. The survey also encompassed all of the members of enrollment networks that I've mentioned thus far, including enrollment assisters, mobilizers, people from the IM agencies, the income maintenance agencies, ADRCs, health systems, qualified health plans, and then state and local government. And I know that there were a few other, I guess I call them mobilizers, but other outreach community-based organizations represented. And of the folks who answered the survey, they at least attended 2 or more meetings. Next slide, please. And so one of the questions that was asked was, what are the important resources that the enrollment networks provide? And as you can see, many of them, not just 1 or 2, but many of the resources that we provide bubble to the top. Of course, the one being Medicaid renewal support, because we're right in the thick of unwinding, but then closely thereafter are our webinars and our trainings, the outreach resources, postcards, flyers, social media posts that they share widely with their community members, communication, promotion, feedback sessions, which is when we bring messaging to their network and that they're able to then give information or resources or thoughts back on how it's being shared with their community. And then the networking and referrals that happen naturally among members, open enrollment updates, the Department of Health Services policy and troubleshooting updates, the qualified health plan resources, enrollment data, and then of course, even though it's not as high, the regular email updates, because there's a lot of information in there. And so what I want to just reflect on is that all of the resources that are provided through an enrollment network are appreciated to a pretty high level. And that is also encompassing on all the different roles that everyone in this call and others of our partners bring to the table. So without a network, we're actually not having all of those things in one place. So it's a nice way to make sure we're packaging all the things that we think help improve access to coverage. Next slide, please. So then another question that was asked was, what are some things that they would like to see enrollment networks start to do? And so a few of the things were full walkthroughs of access and healthcare.gov applications for new enrollment assisters. And this has been something that we used to do in those early years of the Patient Protection and Affordable Care Act, where we would actually walk through a healthcare.gov application. So it's just a reminder to bring that back. Networking across enrollment network members and learning about what other services and programs the organizations that participate offer. So once again, expanding the resources that we're able to then connect our community to. Discussing the ethics of current healthcare and enrollment disenrollment systems, which really is reflecting on our healthcare system at large. What does that look like? How does that impact our community? So people are also looking at what do our systems look like? And then hearing from Medicaid, managed care organizations and healthcare.gov HMOs about the outreach that they're doing in their community so that the community partners can work collaboratively with you all. Next slide. And then I was also able to ask them in the survey what they would like the enrollment networks to continue to do. And so the highlights are provide enrollment policy updates at the federal, state, and local level, have community partners, IM agencies, and Department of Health Services share best practices and ask for feedback to best serve Medicaid members. This is actually a great opportunity to for all of these entities to work collaboratively because we cannot do our work in silos. And so if there's a process that works when we say, you know, certain words with our consumer at the call center, that the call center staff knows this is the route we need to take, those are always like great things to be able to share and make sure that that information is going widely across either enrollment assisters as appropriate, or vice versa back to the IM agencies and the Department of Health Services. It's an opportunity, of course, to share trends, outreach strategies, and relevant case examples, and then, of course, communicate updates to enrollment processes, benefit changes, and healthcare.gov plans. And we just had that happen through the Milwaukee Enrollment Network, where they had a qualified health plan panel that was relevant to most of the state just because of all the plans that are covered in various counties. And we were able to promote that through the enrollment networks and had, I want to say, over 100 so folks participate in that webinar. Next slide, please. And then there's more folks that people want to see at these enrollment networks. We aren't encompassing everyone that does this work yet, but we hope to, and we hope to include you. So if you're one of these groups, whether it's a provider network staff, local government official, school staff, whether it's K-12, community colleges, universities, food pantry staff, partners who work in community reintegration and mental health, community-based organizations that just serve underserved communities generally, and then community health workers and public health departments. We want you. We want to see you. We want you to be included because we know that you also support this work that we're doing here collectively. Next slide, please. And so, as I mentioned, we want you. 93% of the people who have responded to the survey want the enrollment networks to continue. So we're hoping that we can take this momentum and really address access to coverage, including not just the folks who are Medicaid eligible, but knowing that there's a lot of transitions across a year, 2 years, 3 years down the line, and there are still folks that remain uninsured. So we want to make sure we're able to reach all those folks so that our system here in Wisconsin is working for everyone. And so that means we want you to join us through an enrollment network, which there's a link to get connected to your local enrollment network. And you can pick more than one if you represent multiple regions. And then two, if you are a part of an enrollment network, we want to hear from you through this survey. So please add your voice to this conversation as we look to how we can maintain this moving forward. Next slide. I think that might be it. So thank you so much, everyone, and I hope you join us.
Thank you, Carolyn.
Sorry. So I just, outside of open enrollment, the promotions and marketing work group just wanted to give a little bit of an update about the last few months of unwinding since we've been putting out a lot of promotions on that. So without getting too far in the weeds, just kind of a general snapshot. There were a lot of ads and campaigns that were ran specifically in Milwaukee, for Milwaukee, in the Fox Valley, in northern Wisconsin, and then statewide. Of all of the groups participating in the work group, our digital impressions collectively were over 70 million. So we're pretty excited about that. And that is from July 1st to September 30th. Visits to landing pages, whether that be the Covering Wisconsin site that's specific to Medicaid, to learn about how to renew coverage, or the Wiscovered site was nearly 40,000 visits. And then the types of ads that were run were a targeted Spectrum cable and streaming TV campaign, targeted Google ads. There were some movie theater ads in the Fox Valley region, interior bus and outdoor bus stop placards, social media ads and influencers, rural newspapers that direct to local navigators on the ground, and some streaming radio. And then I just wanted to highlight one particular type of ad because these were for free. So our friends that participate in the work group from Partnership Community Health Center reached out to their local bus company, Valley Transit, and Valley Transit donated the use of the space in all of their buses that go through the entire region. So so Partnership paid for the bus placard printing, and then it was displayed for free. And that is a type of community service that Valley Transit was able to offer. And it helps that Partnership has a really wonderful working relationship with the transit company. And the same thing happened in Milwaukee. Empower and worked with the bus company there, also with Milwaukee Healthcare Partnership, and there were a lot of conversations, and they were able to get some interiors like the one you see on the right hand side that was in the Fox Valley. So they got interiors, and they were able to get some bus stop placards. So when people are waiting for the bus, they'll see information about Medicaid renewals. So this is a wonderful type of thing that can happen in your communities just by working with local media companies, to help spread the word that in a way that is more affordable, we can get better coverage out there. Because I will say that unwinding promotions have been challenging because it's happening for such a long period of time. So, okay.
Thanks, Stephanie. So I just have a quick update from OCI, and I'm sort of just going to recap some of the previous content from the work groups, from marketing and from data. So for our open enrollment work, just wanted to highlight that we are certainly encouraging everyone to use the material that we have available on our toolkit. But also, if other people would like to have anything branded, we are more than happy to work with any partners who want to put up a banner on their website or put up a flyer somewhere, make stacks of flyers available. The more different audiences we can get this information in front of, the better. So please reach out if you have any ideas about ways we could collaborate on sharing content from the OCI toolkit or other ideas that you may have for spreading the word about open enrollment. And then also just wanted to touch base on the public dashboard, the OCI dashboard, variously known as a number of different things that Kelsey Avery mentioned during the data work group earlier, that we are hoping to have that available very soon, so that people can use that data and look at that data in a way that's hopefully useful and informative as we continue our open enrollment efforts, and of course the unwinding efforts to just understand the population of people that are uninsured, different people with different types of coverage, and just kind of get a better sense of the health insurance market out there. So we are hoping to get that out very soon, and we will be spreading the word on that when we can. So I'm going to hand it to DHS now to give their update, and I know they have a little bit more to get into detail on the unwinding. So I will hand it off to Director Kuhn.
Thanks, Sarah. Can you guys hear me?
Yep.
Great. Are you able to pull up the slides? Thank you. All right. So first, I'd just like to say thanks to, again, everyone on the call, but also all of our partners. We obviously couldn't be going through this in, I think, a fairly successful manner that we are without all of your leadership. And I know that everyone has really stepped above and beyond and continues to be innovative and creative, and how we can do that as OCI walked through. You know, we really rely on all of you on the ground, those of you on the ground, to continue to work with members and educate the public on how this process is working. And I also just like to give a shout out to the DHS staff. I know all of you have been working with them, and they are, really working 24/7 to make sure that even if there are anomalies, that we work through those conversations, and we continue to look at the data each month to make sure we understand where we're at, and if there are questions about what that data looks like, we're really trying to dig in so that we can address any issues on the front lines. So again, thank you everyone for all of your work. As you all know, we are 5 months into this 12-month process. And just wanted to make sure this member renewal status chart is really just to help people understand when packets go out, what the deadlines are. As many of you already know, but for those that don't, if a member renews within 60 days of being late, during that reconsideration period, they will automatically be backdated for their coverage if they are found eligible. And if they renew between the 60 and 90 days late, they just need to ask for that backdated coverage. So we walk through the process with them. And if folks have questions, again, there is that it's really important for folks to understand as we look at this status, this is how it works. But there is a 90-day reconsideration period for folks, and they can also do that work online. And we continue to try to push people to do that online, those that can, and obviously those that can't. We appreciate their patience as we work through the calls at all of the IM agencies. Next slide, please. So as you can see, and I think one thing that we try to emphasize really important, which is really important, is that obviously we did not know what the numbers were going to look like as we move forward. We tried very hard to sort of mitigate any predictions. We obviously had to set a budget for Medicaid, and so we did that. But what many people predicted is what we're seeing play out, which is prior to the public health emergency. There were additional people that were eligible and then stayed on during our continuous coverage period. So at this point, we're not seeing too many anomalies, but obviously we continue to look at the data as we move forward. We have a static dashboard up, and I can share that in the chat, or anyone could share that in the chat, but we encourage everyone to go to that for the most updated data. And this last month in October, we updated data for September. So again, as we are updating on a monthly basis, we are updating for the previous month. What we're seeing is more than 260,000 Wisconsinites had their eligibility for the program redetermined between June and September. And we are obviously working to post October data in November. And the redeterminations tell us whether, based on information people provided or otherwise, they're still eligible to that those are still eligible to participate in the program. And as you've heard us say before, the data just after the renewal month ends is not the end of the story. And as we've suspected, we're seeing things change during that 90-day late renewal period. So if we look back at June, approximately 62% of the people scheduled to renew that month had their redeterminations finished when we reported that first set of data in July. Now, 3 months later, people are taking advantage. We're seeing that people are sort of responding to that late renewal period, and that nudge that their coverage may end if they don't go through the process by the end of their renewal date. And many of those individuals are coming back, and we've concluded for June about 75%. So we went from 62 to 75% of our June renewal populations were redetermined. And in September, the last month we have data for 63% had their eligibility determined in September. So we'll see how the figure changes when we publish our data next month. So next month we will post the October data, but we will also update previous months' status as people go through that reconsideration period. And part of the changes we see in that, see between the data we post just as the renewal month ends versus during the late renewal period come from renewals that are pending. So as we post the data live for that reporting period, there are still individuals who are in that process. So we just want to remind people what that pending data means. All right, I think we can move on to the next slide, administrative renewals. So at the end of August, CMS provided states with formal guidance on ex parte renewals, and in Wisconsin, we're calling that administrative renewals. The new guidance says that states must complete these renewals at an individual level rather than a household level, which was something that states had been doing for a significant period of time. This was not a conversation or any part of any plans on the front end. It was something that was brought up just recently. And so we are going through that process. Roughly half the states, including Wisconsin, had this longstanding practice of completing renewals by household. We are also planning on issuing an operations memo in mid-November to formalize our new approach. Next slide, please. Thank you. So for members adversely impacted by the previous situation, as of CMS guidance, we are manually restoring benefits for up to 4,000 members who lost coverage in June, July, and August. So in general, these members will go back into the system. They will be in fee-for-service for the months that have already passed. They will re-enroll in their previous HMO coverage is reestablished, and members are being sent a letter letting them know about the restoration of their coverage and what to do if they had medical expenses during the time when their coverage had ended. Again, this is for members in June, July, and August who were administratively renewed by household versus individual. So we are restoring their coverage, backdating their coverage, and they are all being notified that they will have coverage during that period of time. Throughout the rest of this process moving forward, we believe there may be about 2,000 members monthly that would have, under the old system, household system, potentially not been eligible for administrative renewal. And I want to be really clear about this. It doesn't mean that they are not eligible to go through the renewal process either way, but obviously there is a desire on the part of us and CMS to make sure that if people can go through the administrative renewal process, they are able to. So households who, the approximately 2,000 members moving forward, for whom we stopped the administrative renewal process in the past, moving forward, we are working through that process and making sure that we are doing it on an individual basis. So there are also a few policy changes that are coming forward based on different guidance from CMS, as well as different actions by Congress. So the first one is CMS recently issued guidance to states letting us know about the continuous coverage period that will start in January 1 for children. And in addition to that during that period of time, children who do not pay their premiums cannot be terminated from that continuous coverage. So premiums for kids in Wisconsin are required under state law, but CMS is updating the guidance and has updated the guidance to say that we are not able to terminate or disenroll any child during their continuous coverage period for not paying their premiums. So we will continue to send premium coupons, but kids will not lose their coverage during that period of time. They also will not have a penalty at the end of that 12-month period if they have not paid their premiums. So because of this, we're planning to delay the reinstatement of premiums for children until April 1 of 2024. Any child who applies on or after April 1 of 2024 and is over the 201% of the federal poverty level will have premiums for existing members. The first group of members with premiums will be those with renewals due in April. So if someone has already renewed prior to April 2024, they will not have premiums until their next renewal. So for example, someone who renewed in September and moves into continuous coverage in January, they will not have a premium assessed until their renewal in September 2024. So we are also awaiting further CMS guidance on qualifying groups in the program, but we will be implementing the 12 months of continuous coverage for children in Badger Care Plus and most other Medicaid programs as of January 1, 2024. So kids under the age of 19 will stay covered through their certification period, even if their family situation changes. And this includes the benefits of improved health outcomes, reduce financial barriers to care, and hopefully decrease churn for our kids in our programs. So just quickly how it works, if some children enrolled in qualifying programs as of January 1 will continue to have their coverage renewed until their next renewal date. And new members under the age of 19 who enroll in a program as of January 1 will also keep their benefits for 12 months. So if someone has already renewed prior to January 1, again, they are going to still be eligible January 1, and they will move into continuous coverage for the rest of their certification period. So if they renewed back in June 2023, they will continue their coverage until June 2024. What's also new is that we are needing to require premiums and work requirements for the Medicaid purchase plan, which goes into effect as of January 1. So members without continuous coverage as of January 1 will need to pay premiums in January and meet work requirements as of January 31st, 2024. Members with continuous eligibility as of January 1 need to meet these MAP work requirements at their renewal and start paying a premium after they renew. So as of last month, we started making outreach calls to our MAP members who are currently not meeting the work requirement. These calls will continue on a rolling basis through February. Letters to these members will also be sent this month and on a rolling basis through February. And starting in November and continuing through April 2024, we will mail a letter about MAP policy changes about 45 days before the changes will impact a given member. In addition, the Badger Care waiver, which provides benefits for childless adults who are not pregnant, disabled, or elderly with incomes up to and including 100% of the federal poverty level, will need to be extended. We have requested a 5-year extension of the current 1115 research and demonstration waiver. We expect that CMS will approve this extension, but we have had conversations with them and they have indicated that they will not approve of some of the conditions of eligibility that are outlined in our current extension, which includes changing premiums for childless adults and requiring that they answer a treatment needs question for substance use in order to become eligible. So what that means is we anticipate that we will not be able to charge the premiums and that we will no longer need to ask the question about treatment needs. this is obviously not official yet, and we are waiting to get the official feedback from CMS about the extension. But we do anticipate that the extension will be communicated to us, and that they will approve it for unfortunately not 5 years, but likely a temporary extension through the end of next year. So those are my updates. I hope that was informative. Thank you.
Thank you, Director Kuhn. I have not seen any questions come into the chat at the moment. So does anybody have any questions? Feel free to put it into the chat. The recording of this meeting, as well as recordings of all prior meetings, are on the OCI website. If you just search for Healthcare Coverage Partnership on oci.wi.gov, you'll be able to watch this meeting back or other previous meetings if you want to recap any information shared. And then, of course, all of the contact information for those who presented, that was on the slides can be found on that website when you look back at the meeting from today, if you want to follow up with anyone directly. So I still don't see any new questions coming into the chat. So I think we may wrap up a little bit early today. The next forum will be scheduled for Monday, January 22nd. So plan on holding that date on your calendars. If we need to reschedule for whatever reason, we will send out a meeting invite as usual and share an updated date and time. But at this point, plan on January 22nd at the usual time at 2 p.m. So thank you, everybody. Appreciate your time today.